On this model right here, we have the condylar inclination set to 45 degrees, which is huge. 45, this is 45, that's a lot. What that means is that the bone here is very steep. If the inclination is at 20 degrees, the bone's like this. If inclination is 10 degrees, it's like this. The steeper, the higher the number, the steeper the
What's the normal?
the bone. About 25. Why is this important? Why is that bone important? To see how this sits on that bone when you move. Now, when you look at this case here, let's look at this articulator. I'm going to change. I'm going to show you what's interesting about this. This patient, this is their bite. Okay, I don't care about their bite. The bite is the bite. That's whatever. If I unlock this articulator and I have them move into excursion, so I have them move to the right side. Remember, it goes backwards. What you have here is you have anterior guidance. You also have here condylar guidance. See how it's rolling up the condyle? What this does is this inclination gives you space because this is hitting here. It's two things. See how much room you have over here? Tons of room. See if you go the other direction, how much room do we have on this side? Tons of room. This is the kind of tooth that you can build long cusps in the front, in the sides, and they're gonna clear. Now let's say you screw up and you change the inclination to let's say 0 degrees or very, very low. I want you to show what happens. See, that's 45 degrees. Let's change it down to 5 degrees or very, very, very small. That's not supposed to slide that much back. Now I change the inclination to about 5 degrees or almost 0. Now watch what happens when I move. This space now
Is less.
is less.
Smaller.
This space is very, very small. Now, if you have your inclination set at 10 degrees or 5 degrees, and the patient has an inclination of 40 degrees, that's fine. Your cusps are going to be smaller. You're going to clear, right? Now, what happens if they have an inclination of 10 degrees? You set the condylar inclination to 25. Now you've mistaken. Now you think you have more room in the back, so when you make those cusp tips, they're going to actually bump each other when you move. See right now? That's the inclination. Look how little room there is. Not a lot of room. Now, if I change it,
You changed it to.
let's say 45 degrees. So I'm gonna make
45.
it more extreme, just to show you.
All right, now we're looking at the patient
Oh,
MB.
okay, this is actually bad mounting.
Bad mounting.
She has a lot of
MS. What
No,
about
that's-
MS?
that's
You
too
just
much
did
wear,
that.
Too much wear. Try to find someone that doesn't have as much wear. Who's this? I need someone with better mountings or better.
You don't have a matching color of the model, so that's not
Maybe.
it.
I want to show you this one again. I'll show you her case quickly. There's Mr. Hassan. So we have inclination set of 45 degrees. So if you move laterally and you want to check interior guidance, look at that beautiful interior guidance. Look how the teeth are nowhere near touching. Not even close. No interference whatsoever. You change the inclination.
That was on 45.
45. You change the inclination to 10. I'm just trying to exaggerate the inclination. When you move laterally, you're closer. See how the space isn't as big anymore? And the way you record it is when you go through protrusion, the front teeth bump. How do you record inclination? When this patient goes protrusion, this is very flat. Look at the space you have in the back. Very little. That's why they squirt the material in the back to measure it. If I change the inclination to 45, I want you to see how much room we have. When they go in protrusion, lower jaw slides forward. Look how much space you have there. Because when you move back, these are touching. The condyle is raising the ramp of the back.
Could you explain one more time how is this?
When this patient slides forward,
How is this there?
the steeper the incline, the more room. So when they go interior, edge to edge, front teeth are touching. Front teeth have no effect on the back here. The steeper the incline,
Meaning less degree.
the more degree.
The more degree.
Right here, the contact is the same. If my incline was steeper, I'd be here.
I see. That's more degree.
That's
stood.
why when we do the protrusion record, that's why we have them go forward, edge to edge. We squirt it in the back, but and then how much room you have, you can then program your articulator.
Now on this skull, where do you measure this angle? 45 degrees? You saying it's
You
steeper.
measure with
What line do you build?
Basically, this
Visionary.
right here, this right here is this right here. That's articulator. Now, on the other patient, she said when she bit down, she went to the left side. I'm going to lock the centric lock. What do you think of her bite?
It's open on the right.
Left. All right, that's what she said. I only hit these teeth when I close. Now, when I unlock it,
So right now it's on what degree?
now don't worry about that. This is just her centric bite. Now, if I squeeze the teeth together, they fit together.
That's
but
for
her initial bite is here.
multi-customization.
When she's doing her initial bite, she's opening and she's closing. This is seated. As she's closing, these teeth are hitting first. Okay? Now
That's her centric relation.
Now for her teeth to fit together, she's doing this. So if you
Comfortable bite.
So if you imaged her jaw here, only thing hitting, condyles are in the right position. If you imaged her here, here, this condyle would be out of this condyle would be sitting here.
You manage it by adjusting the cusps?
By either adjusting the cusp or ortho.